Hi, I'm Angie, your healthcare guide. Today, we're looking at medical bills. That scary stack of paper with codes, charges, and maybe even a few surprises. What does it all mean? I'm here to break it down with real examples. So let's get started. Let's start with the basics. A medical bill, sometimes referred to as an invoice, will typically list the services you received, the charges, and what you owe after insurance. Some bills will list additional information, such as codes associated with the services and details on how your insurance company paid the charges. It might look overwhelming, but it's broken into key parts. Let's take a look at a sample bill. This patient saw their primary care provider for stomach pain. The total amount due is $600. I'll use this sample to show you how it all works. Now, here's a heads up. You might not always see the same details, things like CPT codes or ICD codes. Some providers will include them, some don't. So don't worry if your bill looks a little different. We'll still figure it out together. First, let's take a look at the services. Your bill will usually provide a simple description of the medical services you received. Now, those codes that I said might be included, CPT codes describe the service. For example, this 99214 for this office visit. CPT stands for current procedural terminology. Think of this code as the what we did part of the bill. ICD codes, or International Classification of Disease Codes, diagnose the condition. For example, the R10.13. You can think of this code as the why we did part of the bill. These codes help insurance companies process medical claims. But if they're incorrect, the insurance company could deny the claim. It's not necessary to understand these codes, but it is a good idea to review your bill along with your explanation of benefits to determine if these match and to understand your insurance company's payment for services. Next, we have the charges and payments. The billed amount is what the provider or facility charges for a particular service, like $150 for an office visit. Then we may see additional information regarding how the insurance company processed this charge. This may include details on an adjustment or allowed amount. The allowed amount is what your insurance company agrees to pay, which, if the provider is in network with your insurance company, will be a negotiated or adjusted rate that is often less than the billed amount. Insurance might adjust this amount to $120. Again, reviewing your bill along with your explanation of benefits is important to understand your insurance company's payments for services. Once your insurance company has paid their share of the charges, you'll most likely be responsible for any remainder. This is where things can feel a bit tricky, and I highly recommend reviewing this portion with your explanation of benefits. Remember your deductible from my summary of benefits and coverage video? You're going to pay that first. This is why the office visit and ultrasound in this example bill are all patient responsibility. If you have a $500 deductible and have not met any of this yet, you will be responsible for the allowed amount for those charges. After your deductible is met, your insurance company will begin paying. In this particular example, the coinsurance is 20%, meaning your insurance company will take care of 80% of that allowed amount, leaving you to pay the remaining 20%. Again, I know this sounds redundant, but reviewing these amounts with your explanation of benefits is recommended. Mistakes can happen both on the billing side and the insurance side. So it's helpful to fully understand what you are responsible for paying. Additionally, several states have laws to protect you from surprise billing when out-of-network providers charge beyond what insurance covers. Check your state's rules related to the federal No Surprises Act or your explanation of benefits. And if something feels off, reach out to your insurance company or provider. They're here to help. Now let's take a look at some real life scenarios. Let's look at Jack's bill first. Jack had an office visit at his primary care provider's office for $150, but insurance adjusts this to $120 since his provider is in network. Jack has met his deductible, so he will be responsible for the $30 copay, and his insurance company will take care of the rest. Next, Lucy. Lucy had surgery and received her bill. The total charges are $5,000. Insurance paid $3,280 after adjustments. Lucy has already met her deductible, so her responsibility is $820 for her portion of coinsurance. And finally, we have Nathan. Nathan's bill shows $500 for charges and patient responsibility. It looks like his insurance company did not allow any amount for the lab test, and they didn't pay either. In this scenario, it would be recommended for Nathan to review the explanation of benefits from his insurance company to see if there might have been an error in processing. Remember, mistakes can happen, so if something looks off, it doesn't hurt to review with your insurance company or provider. And that's how to understand your medical bill, from charges to payments to understanding your responsibility. On your healthcare guide, we'll keep breaking down topics like this. If you like this video, please like, subscribe, and pass it along. Thanks for watching, and I'll see you on the next one.